The advice to adjust goals, stay in low heart rate zones, and gradually increase activity when recovering from injury is medically appropriate general guidance. Injuries require modified activity, not complete rest in most cases. Gentle movement often speeds recovery by maintaining circulation and preventing excessive muscle atrophy and joint stiffness. Using heart rate monitoring to ensure you're not overexerting during recovery provides an objective measure when your judgment might be impaired by frustration about being injured. Tracking progress during recovery serves multiple purposes. It shows that you're still doing something active, which helps maintain psychological connection to exercise. It provides data on whether your recovery is progressing appropriately. If the same activity gets easier and requires lower heart rate week by week, that's a good sign. It also prevents doing too much too soon, which is the most common cause of re-injury. Having a conservative plan and tracking adherence to it builds patience and reduces impulsive decisions to test your injury before it's ready. However, this advice comes with massive caveats and warnings. First, not all injuries are appropriate for self-management. Serious injuries, unusual pain patterns, or slow healing require professional medical evaluation. Depending on your watch to guide post-injury exercise without proper diagnosis is potentially dangerous. You might be doing more damage while thinking you're being careful. Second, the focus on closing activity rings during recovery can actually be harmful. You might push yourself to maintain arbitrary activity levels when true rest is what your body needs. Third, the gradual increase guidance is vague and could be misinterpreted. How gradual? By what metric? Increasing activity by 10% per week is a common rule, but even this can be too aggressive depending on the injury type and individual healing rate. Without specific guidance tailored to your injury and situation, you're guessing. Fourth, pain is complex. Some post-injury discomfort is normal as you return to activity. Other pain signals continued tissue damage. Distinguishing between them requires experience and body awareness that many people lack. Continuing to exercise through harmful pain while staying in a low heart rate zone doesn't make it safe. The safety checklist infographic would need to include: get medical clearance before returning to exercise, start well below your pre-injury activity level, increase gradually with guidance from a professional. Stop immediately if you experience sharp or increasing pain, and don't compare your recovery timeline to others. Even with these warnings, there's risk that people will use the watch as a substitute for proper medical care because it's convenient and doesn't require admitting that they need help. The watch can be a useful tool within a comprehensive recovery plan supervised by healthcare providers. It should never be the primary decision maker for post-injury exercise progression.